Why should rare diseases be a public health priority? Well, Rare Disease Day is a pan-European event, and I hope in future an international event. And that is actually part of the message itself. For clearly, it is impossible to develop a national public health policy specific to each of the more than 6,000 rare diseases. However, a cross-national and comprehensive approach, rather than a piecemeal one, can give rise to suitable solutions. A European approach to rare diseases enables the individual rare disease patient to escape isolation. Appropriate public health policies can be developed in the areas of scientific and biomedical research, industry policy, drug research and development, information and training of all involved parties, social care and benefits, hospitalization and outpatient treatment can only be developed on a European scale. In order to foster clinical research, the public funding of rare disease clinical trials should be promoted through national and European measures. We are, I believe, on the right track to achieve our advocacy objectives, and the success of the first Rare Disease Day, which have partly been displayed on the screen here, is an important step in this direction. Our wish has been to reach out to important decision makers at the European level. We ask them to take on our cause and actively support people living with rare diseases in Europe today. The support we have received from the European Commission and from members of Parliament and the interest shown in this first European Rare Disease Day demonstrates that we can hope for further support in our efforts.
I won't go into detail on the consultation paper either. I'm sure everyone has read it. Judging from the number of responses that we've received, I'm sure most people in the room have responded to it. So I don't think there's a need to go into the detail of the consultation paper. I will simply say, when you look at the range of issues that it raises, you will see, or I see, two things. One, an enormous potential for action. Two, an enormous challenge to the Commission and to the other institutions to find the resources and to find the efforts and to make the actions and the initiatives a reality to act across that very broad range of possible areas. Fundamentally, at the moment, as we go through the process of ratification of the Reform Treaty, there's a lot of discussion in a lot of member states about what is the European Union for? Why are we here? Why have we gone through all of these years of European integration, and what actual value added does it bring? And I will not go into the detail of that debate, except to say that I am, of course, confident that it brings a great deal of added value in very many areas. But a lot of the discussions that we have are sometimes focused at those of us who are professionals in the area, who work on European integration, and we understand the arguments well. But we also need to have actions which are very clear for citizens in their daily lives. And I cannot think of an area where the European community can act with more relevance to citizens in their daily lives than in providing a real community strategy on rare diseases. It's a privilege to work on the subject. It's a privilege to work with the stakeholders involved in this, who have provided enormous support to the European Commission. And we count on them to continue doing so, because it will be critical for the success of any community strategy. Because we cannot do this alone. The whole point about this strategy will be about solidarity between people, between countries, between professionals, between different actors within the institutional structures. And therefore I'm doubly grateful to be part of an event today organised by a broad range of actors, and I look forward to working with all those concerned as we prepare the strategy over the coming months.
What was the main achievements, or what do we see as a success in the outcome of the 6th Framework Programme? Is we were able to mobilize top researchers. We were able to address the still very fragmented landscape in research funding in this area, and an impressive number of produced new knowledge. We were able to coordinate research into rare diseases at European level through projects or initiatives like Orphan Platform or the ERANET I mentioned earlier on. And we were able to mobilize and dialogue with stakeholders, and stakeholders obviously includes also patients' groups. And as always, there is room for improvement. We need to do more in clinical research, and we also have to consider how to better focus some of the topics. This 7th Framework Programme provides many, many opportunities to further strengthen research in rare diseases. They obviously require an active participation of all the stakeholders to make research into rare diseases also in the 7th Framework Programme a success, as we have seen in the preceding ones. Research, and not only we are convinced, is an important aspect in the context of the communication on rare diseases, and I understand that it will be given due consideration.
Jennifer Rachel Green was born on a frosty morning on the 8th of December 1978. From the very start, Jenny was a smiling and happy baby, but one who constantly vomited. On the 23rd of April 1980, 15 months after celebrating Jenny's birth, we learned our lovely daughter had a rare, incurable, genetically inherited, untreatable, metabolic disease called cystinosis, which would destroy her kidney function and ultimately kill her. But the long days and very short nights, or is it the other way round, are not good for those with a chronic disease. Jen contracted a virus which was to lead to a very rare complication of transplant medication. She succumbed to Burkitt's lymphoma, yet another rare disease. Once again, Jen spent a birthday in hospital. Once again, she battled through, and by the following April, her treatment was over, and Jen headed straight for Manchester to help at the Commonwealth Games, working in a team to provide meals for the athletes. This was to have a dramatic effect on Jen's health. She contracted shingles, which is a virus that is deadly to transplant organs. 2006 started badly, with a virus affecting many people, including Jen, who had to be hospitalized because of her specialist condition. Peritonitis followed, and then many other symptoms which were causing me more and more anxiety as the year progressed. It felt just like 1979 again. Nobody was listening. For us as a community that cares about rare diseases, however, it is also a relay race where we must, in order to ensure equality of care for the rare, pass on the baton from the patient as spokesperson to the clinician and researcher and on to the policymakers to ensure that the public health strategy is sustained beyond the short-term proposals currently in place. As a patient, Terkel and I hand this baton to you, the policymakers, to ensure that rare disease patients are brought out of the darkness into the light. That is also the legacy of Jen, whose life inspired the creation of CLIMB.
I'd like to conclude now, invite you all to the cocktail now, and perhaps I'll connect to what Mr. Fay said. We depend on the commitment of member states. That's essential on this issue, but nonetheless, we've underscored the potential of European added value on these issues. Now, for the time being, there are all sorts of possibilities, and there's the organ donation communication, the communication on rare diseases. We're looking forward to the communication on information for patients, all of which I hope we'll see before the end of this parliamentary term. So Europe has done or is doing a great deal for climate change. We're setting the agenda, the timetable. And I think we can do this on this front, on this set of issues, and I'm sure that we'll do that. Thanks very much for coming on this afternoon.